Okay, we are going to get started on our week 5 onboarding call. Go ahead and do full screen. And we will get started. This week should be nice and short and sweet. The next one will be a little bit longer, so just kind of mentally prepare for that one because we will be, I believe we're going over chemical peels on that call, but week 5 is pretty fast. Okay, so today we're going to be talking about the bunny lines. We're also going to be going over, I guess we are going over chemical peels today. And then we're going to talk about aesthetic records, some common errors, and then some marketing ideas. Okay, so bunny lines. This is caused from the nasalis. Whenever you activate the nasalis muscle, it will form these little kind of resting static lines that go on the bridge of the nose. It's really simple to treat. You treat it as a small muscle group, so you're going to hit it at 2.5 on each side. You can also do additional injection points a little bit lower on each side as well. So for a total of 10 units total if you're using Dysport. If you're not using Dysport and you're using Botox or Juvo, it would be a total of 4 units. So remember, 10 equals 4, 5 equals 2, and 2.5 equals 1. So here's a quick going over it. And then this is the derma peel one. So we're going to watch this video. Alyssa, please let me know if you cannot hear it, okay?
Welcome to the Bella Medical Products training video.
Can you hear that?
In this video presentation, you will meet some of our corporate staff, receive additional product information, hear testimonials, and view demonstrations of the Perfect Derma Peel application. Founded in 2011, Bella Medical Products is dedicated to formulating innovative, result-oriented skin solutions for the aesthetic medical industry. Ranked as one of the top 3 new anti-aging products of 2011 by ABC News, the Perfect Derma Peel delivers healthy, ageless skin for all skin types and ethnicities. Bella Medical Products advocates the practice of less invasive cosmetic treatments by providing cutting-edge products to plastic surgeons, dermatologists, cosmetic physicians, and other medical professionals. The Perfect Derma Peel and the Perfect Skincare System product line allow us to offer an exciting new future for skin transformation.
The Perfect Derma Peel is my go-to peel for all of my clients because of its versatility for all skin types and skin issues. I love how the Perfect Derma Peel has little discomfort, and with such little downtime, the results are dramatic.
My clients have benefited from the Perfect Derma Peel for several years now. Applying the Perfect Derma Peel is very easy, and our patients are thrilled with the results.
The Perfect Derma Peel by Bella Medical Products is committed to providing skincare products that deliver superior results to the aesthetic medical community. The Perfect Derma Peel is a safe and effective treatment for aging skin and is the only peel to feature glutathione, an antioxidant with powerful anti-aging benefits. The Perfect Derma Peel is available throughout the U.S. and is growing in popularity worldwide.
Hi, my name is Lana Petrovic. I'm the Director of Operations for Bella Medical Products, and I'm going to explain to you some of the benefits of the Perfect Derma Peel. The Perfect Derma Peel will improve the overall clarity, tone, and texture of the skin, reduce or eliminate hyperpigmentation and melasma, control acne, remove or reduce sun damage, soften fine lines and wrinkles, and minimize the appearance of pores. The Perfect Derma Peel is beneficial for all skin types and all ethnicities.
I feel very comfortable using the Perfect Derma Peel because it's very safe, and at the same time it's very effective, very result-oriented.
The Perfect Derma Peel is one of the easiest peels I've ever performed. I've been giving peels for 20 plus years in this business. It's 1, 2, 3 easy. It's a half-hour process. They're fairly comfortable throughout the entire procedure. It's great. They're up, they're gone, they're fine. They absolutely love the result. It's a great thing to do when you're preparing to go on a vacation or a wedding. Anytime you want your skin just to look flawless, they absolutely love the Perfect Derma Peel.
Hi, I'm Michelle Ray with Bella Medical Products. The Perfect Derma Peel is a medium-depth medical-grade peel featuring a unique blend of acids that address many common skin concerns. The peel contains TCA, retinoic, salicylic, and kojic acids, phenol, vitamin C, and antioxidant glutathione. Each acid is under 12%, and the peel is pre-mixed for easy application.
I really enjoy working with Bella Medical because the customer service is amazing. I mean, I've never had any issues. It arrives on time, the product is consistent, and they're really easy to work with.
I am Nafis Sabai, the founder and CEO of Bella Medical Products. We are committed to providing skincare products that deliver superior results to the aesthetic medical industry. We are happy to welcome you as a provider of the Perfect Derma Peel.
Hello, my name is Juliana Wagner. I am a licensed esthetician of 20 years, and I'm also the senior trainer for Bella Medical Products, and we're here to do the Perfect Derma Peel today. So Natalie has concerns with fine lines and wrinkles, so we're going to do the Perfect Derma Peel on her today to bring back that healthy glow to the skin. So what we prep the skin with prior to the peel is 100% pure acetone. It degreases the skin so that the peel gets down into the skin evenly and deeper into the skin as well. I'm going to have you hold your breath and tuck your lips, please. Any areas of concern, such as fine lines and wrinkles, as well as hyperpigmented spots, deeper lines, you want to be more aggressive with your acetone in those areas, again, to get that peel down in there to do a better job. A good 2 to 3 passes is necessary. Next, we're going to go ahead and put the peel into the cup here. And you're going to want to apply it with one of the 2x2s that come with the peel. And you're going to fold it into a little bit of the square. In our first pass, we're going to go lightly just to numb the skin. How are you feeling, Natalie?
I'm good.
Good. So the active ingredients in the Perfect Derma Peel is the TCA, salicylic, retinoic acid, vitamin C, glutathione, kojic acid.
It's kind of tickle now.
And with the phenol in there, you don't have to have the pain.
Yeah.
We're going to feather into the neck 1 to 2 layers, and directly underneath the eye 1 to 2 layers as well. I'm going to have you look up towards me, please. And go ahead and close and relax. You're going to layer the peel till it's gone. You're going to look for frosting as your end point, as well as erythema. You want to redip often into the cup so that it stays nice and even throughout the peel. I'm going to have you look up towards me, please. And that'll be the last layer underneath the eye as well into the neck. And then we'll finish the peel throughout the rest of the face. Almost done here. And you just want to work it through once your cup is empty till your gauze is practically dry. And that's it, as simple as that. So next, we're going to go ahead and go over the post-peel kit with Natalie. Natalie, the peel is supposed to be left on in 6 hours. It self-neutralizes. So you can wash your skin in 6 hours, but preferably I'd like you to go ahead and leave it on overnight if you're not uncomfortable in any way. In the morning, I'll have you wash with a very mild cleanser, and then you're going to go ahead and I'm going to recommend that you take one of the 2 towelettes that are in your post kit. I'm going to hand you the directions as well. And this is a towelette that you're going to use on clean, dry skin tomorrow morning. And this has vitamin A, so it's going to help to expedite the peeling process. So we'll go ahead and you'll use the towelette fairly aggressively. You're going to rub throughout, make sure you get under the eyes really well, and also feather it into the neck. You're going to go ahead and wait at least 30 minutes before applying any sunblock on top. And then you're free to wear makeup that day if you choose. Then that evening, I'm going to have you go ahead and I'm going to have you cleanse again with something mild again, and then go ahead and use your second towelette. And again, very aggressively, you want to rub it throughout the face, feather it into the neck and under the eyes, and then just go ahead and sleep with that on overnight. Okay? Then after that, the next day you're going to start to see that you're going to start to peel around the mouth. And that's where we talk and move our skin the most, so it'll peel first, and then it's going to kind of just slowly peel out for you. So during that process, you're going to use the hydrocortisone 1% cream that's in the kit as well, and that's all you'll need along with your sunblock. Okay, and then it is a 7-day process, and then you're going to just look beautiful and glowing as you naturally are.
Thank you so much.
All right, thank you. Prior to the application of the Perfect Derma Peel, it's important to go over the contraindications with your patients. Contraindications include pregnancy, breastfeeding, Accutane use within the last 12 months, hypersensitivity to any of the peel ingredients, or aspirin allergy. Do not apply to skin that is still irritated from any harsh treatments such as lasers, waxing, electrolysis, or chemical exfoliants. Do not apply to open wounds, sunburn, infected skin, cold sores, herpes, or lesions. It is important to advise patients with a history of cold sores to be given an antiviral prior to the peel. For overall rejuvenation, we recommend doing the peel no more than 2 to 4 times per year. However, for chronic conditions such as acne, hyperpigmentation, melasma, and concerns with fine lines and wrinkles, we do recommend a series of 3 peels 30 days apart. For thicker and more resilient skin types, melasma, and acne scarring, we recommend adding the Perfect Derma Plus Booster to the peel solution for optimal results. The peeling process will vary per person based on skin type and skin condition. The peeling process will start within 48 hours, intense peeling for 2 to 3 days, and an additional 2 days remaining with the residual around the hairline and neck areas.
If you have any additional questions or need more information, please feel free to contact your local
Okay. Any questions about the peel?
Nope.
So it's a really kind of easy, fun peel to do. It doesn't require a whole lot of downtime. So whenever you are actually going through the peel process, it is self-neutralizing, which is really nice. So you really just kind of put it on the patient, and just like the video says, you let them leave, and then that night they can either sleep with it or they can wash it off, just depending on what time you did the peel, but it has to be on for a minimum of 6 hours. More than 12 hours, it does tend to get a little itchy. So after 6 hours or so, I usually tell the patient to go ahead and just wash it off, and then don't put anything on that evening. And then when they wake up the next morning, that's when they will use that first towelette that you will send home with the patient. And then that evening, they'll use the second towelette and then sleep in it. Now, the peeling will start around the mouth, and then it will kind of go up. It's really, really important that you tell your patients that they do not pick at their face, because I did that and I started like peeling my skin off because I'm a picker, and I was like, oh my gosh, I think I was going to scar myself. So please make sure you do not, or I'm sorry, you tell your patients to not pick at their skin. It is a medium depth peel, so they are going to peel. It is normal and expected. It does tend to get a little itchy, but once all of the peeling is done, you really do have that kind of baby soft skin. It gets rid of some acne. It helps with scars, fine lines, and wrinkles. It's taken away my sun damage, especially my forehead. It's helped with my crow's feet. It really is a great peel. I highly recommend all of the injectors try it before they try it on a patient, just so they can say what it feels like, you know, what should be expected, and they can show their own before and after photos. You can order your peel from Stephanie, and remember, you do get 50% off of it. Okay, moving on. Okay, so for aesthetic record, there's a couple of different big pitfalls that you need to be aware of. So whenever you're charting, you do need to make sure that whenever you go, that there's only 2 different types of tiers that we have. We have the non-tiered product, and then we have the tiered product. So make sure that if you do select the wrong product, it will affect the patient's overall payment. So please make sure that you're selecting the right tier. So for instance, a Botox, if they're getting 40 units of Botox, it would qualify for a tier. So you will actually choose Botox Platinum. But if they're just getting a lip flip, you will simply go to the product section of Aesthetic Record and just click on Botox. The easiest way to do this is to go ahead and pre-chart on your patients. So go ahead and go through all of their consent process, take their pictures, and then mark on the patient's face where you're going to go and do all of your injection points. And then you can give the patient the idea of how much everything is going to cost. It makes it really, really easy for you to do that. Okay, so this week for marketing, there's a big ask this week. So you are going to join, we want you to join a networking group. It can either be an in-person networking group or it can be an online networking group. The purpose of this is to get you out of your warm market. We want you to start reaching out to your cold market. At this point, the majority of y'all have already had your launch parties, or they are about to start here in a little bit. But please go ahead and join a networking group because that will really get you out of your comfort zone. Then the other thing that you're going to do is you're going to post a before and after of a chemical peel. I already have that picture for you, so I will upload it to the Facebook page for you, so you can simply grab it and post it to your social media. And then the last post that you're going to do this week is going to do a post about the benefits of a chemical peel, and you are going to do this post on your own. You will have access to those videos, and so you can see the benefits of it, so you can create your own post. So feel free to watch this video as much as you want to kind of go back so you can hear all of the benefits of it, so you can create your own education post. So 3 homework assignments. You're going to join a networking group. You're going to post the before and after of the chemical peel that we will give you. And then the third one's going to be an education post that you are going to create about the benefits of a chemical peel. You're going to continue your social media following. You're going to add 3 more different people that you were going to start following. The first 2, they are simply on Instagram. So you have these 2 injectors here. The third one, it's actually a podcast, and her name is Jessie Lee. She unfortunately did pass away last year, but she was incredible as far as marketing goes. She was just the kind of the guru. She did a lot of network marketing things, but just for getting yourself out there, how to promote yourself, how to start a business. She had a lot of tips and tricks, and she was just such an amazing person to listen to. So she has so many different channels and so many different shows that she did. So please start listening to her, and you can get a lot of motivation and a lot of kind of tips that you can learn from her. All right, so that is it for this week. We are going to be done. I will be posting the link, the Google link this week, along with some of the quiz questions and the magic phrase. The magic phrase this week is going to be angel fire, because my family is actually an angel fire. So this week it'll be angel fire. I will create that Google link for you, and please go ahead and fill that out, and we will see y'all all next week. Bye, guys.
Bye. Thank you.